Ax or Ask, Donda's Rules, Suit Shoes. All available at McClendonReport.com.
CLTV celebrates Juneteenth and the freedom to choose. Tonight, let's choose better health for our families and ourselves by paying attention to our diet, brushing our teeth, and exercising. Dr. Ron Schefdore joins me tonight as we discuss the freedom of healthy choices. Tonight on Garrard McClendon Live. Welcome to a special edition of Garrard McClendon Live as CLTV celebrates Juneteenth and the freedom to choose. In 1865, more than 2,000 United States troops had to march into Galveston, Texas to inform slaves of their freedom. June 19th was the day when history changed for the better. And still today, the freedom to make good choices. Joining us now from CLTV Studio C is a humanitarian, disease prevention advocate, and Chicago cosmetic dentist, Dr. Ron Schefdore. Dr. Schefdore, how are you this evening?
Excellent. Thank you so much for having me on.
It's great to have you on the show. You know, let's talk about, the fact that, yes, you are a dentist, a doctor of dental medicine. Teeth, that's your profession, but why is there such a great interest in other areas for you?
Well, I've been doing cosmetic dentistry for so long, and I realized, what good is it if I make a person just a gorgeous looking smile and they don't feel good?
Yeah, that's a great point. And let me ask you this. Dentists versus family physicians. I've always wondered about this. I think that there's 4 different types of people. You've got people that like to go to the doctor, like to go to the dentist. You have people that like to go to the doctor, don't like the dentist, or don't like the doctor, like the dentist, or don't like either.
Yeah.
It seems as if what you're trying to do is act as a conduit for those people who may be afraid of going to the doctor. If they come to you to get their teeth looked at, it's like you hit them with another angle by saying, hey, let's get something else checked out. How has that been beneficial for people and their health?
Oh my goodness. About 6 or 7 years ago, I started doing this, looking at people and asking, do you go to the physician? And we found out that most people go to their dentist much more often than they go to their physician.
Yeah.
So the dental office is the perfect place to screen people for some chronic disease, because bleeding gums is the first sign of diabetes. So we have very simple, inexpensive tests that are FDA approved, and the patient gets a lab report and the dentist gets a lab report to share with the physician. And just the physician will diagnose it, and I don't want to diagnose it, but I just want to screen people to see who should be over there getting their medical work done.
Yeah, wait. So bleeding gums?
Yeah.
One of the first signs?
It is the first sign.
Wait, how could that be? First of all, why? And where's the connection to diabetes?
Okay, good question. Blood vessels are a big problem with people that have diabetes. That's the first thing that goes. That's why they have kidney trouble and eye trouble, and they have cold feet and hands. Circulation is a problem. Well, the dentist sees that in the mouth before it goes anywhere else. So dentists and hygienists are the first ones to see this. The 2 people that I just identified as a possible diagnosis of a diabetes, we send them over to the physician, and sure enough they were, but they had no idea. We caught it way before the physician ever could, and they had none of the classic symptoms.
Now, who can catch this? I mean, and if you could break these down for us, periodontist, orthodontist, dentist. Please explain the different types of doctors here and who's more apt to catch this.
Okay, the general dentist is kind of like the family doctor. He gets everybody. So if you think of a funnel, the general dentist is the top of the funnel, and we see everybody from children from 2 to 92. So the specialists are the periodontists. So after somebody comes to me and they have a problem, and it's a big problem, then we refer them to the specialist, such as orthodontist, periodontist, and all the other specialties.
Yeah. Now, when it comes to bleeding gums, and we're going to talk about Americans Against Diabetes in a minute.
Oh, good.
But when it comes to bleeding gums, how do you stop your gums from bleeding? Is there some sort of procedure? Is there something we can do day to day to help that?
Yeah, absolutely. What we developed in our office about 5 years ago, and the research is now proving how well and how effective this is, and now we have the blood chemistries to prove it, is you need to fight gum disease from the outside and the inside. A lot of times it's a nutritional problem. and it's a bacterial problem. And the products that are generally on the market really aren't that effective. I tell people you need the industrial strength in order to solve this problem.
Yeah.
So we have products that were developed by specialist periodontists. One is called Closis. It's a mouthwash and a toothpaste that really works well and has no alcohol. And then there's some nutraceuticals that people take to fulfill the requirements or the lack of vitamins and minerals that they have in their system. And compliance is a big deal. They're not going to floss, so we have some toothpicks by Butler, by Sunstar. You'll see them in the grocery store called soft picks that are fantastic to use, and they can take the place of floss.
Yeah. Americans against diabetes. Why not Americans against gum disease? I mean, come on, for crying out loud. Dr. Schefdore, you're a dentist. Come on. Why Americans against diabetes? Talk to me.
Okay, I'm so glad you asked this. I'm so excited about this program. We want to test 100,000 children in Chicago this year. And you go, well, why would you even want to do this? Why is it so important? Well, Healthy Life Labs, one of the major retailers, used the blood test from Healthy Life Labs. And it's a very inexpensive, very cheap test to do, but it's very accurate. They use them to test children for 30 days in 6 retail outlets. And in 30 days, what we found is that 27% of the children had pre-diabetes.
Oh.
Nobody else knows this or is talking about it. Now, our future is about these children. Now, I'll tell you why this is so significant. What happens in 10 years or 15 years from now is that those children now that have pre-diabetes, many of them are going to become diabetics. Diabetes is going twice as fast. Listen to this statistic. In 1995 to 07, 4.8 out of 1,000 people were diagnosed as diabetes. In 2005 to 2007, 9.1 out of 1,000. This is going at such a fast clip.
It doubled in just a matter of a few years, Dr. Schefdore.
10 years.
You know what? Hold tight. I've got to go to break because I want to talk more about pre-diabetes after the commercial break.
Good.
Hold tight. Been to the doctor lately? How about the dentist? CLTV celebrates Juneteenth with the freedom to choose good health.
Part about this is just, people are doing it out of the goodness of their heart, and we're just raising money as a collective good to cure this, horrible disease that affects millions of people everywhere.
Welcome back to Garrard McClendon Live as CLTV celebrates Juneteenth and the freedom to choose. We're choosing good health tonight, trying to eradicate hypertension, gum disease, and diabetes with Dr. Ron Schefdore. Dr. Schefdore, let's talk about pre-diabetes because you're making it seem as if diabetes can be prevented. So, okay, how can a person have pre-diabetes?
Okay, great question. If we can catch these children while they have pre-diabetes at a young age, they can be counseled on to change their eating habits, exercise more, and prevent diabetes. Almost in 70% of the cases, you can prevent diabetes if you were just to identify it early enough and change your lifestyle. Like in my brother's case, he died at 48 of diabetes complications. He didn't find out till it was way too late, and the damage has already been done. We've got to identify these children now. Now, think about this. If we did this program and tested 100,000 children in Chicago and became the leaders of a grassroots movement like this, imagine 50 of the biggest cities in the United States doing the same program as us. We would improve the health of America overnight.
Yeah.
And our future.
Yeah, that's for real. Let's talk about foods. Of course, as a dentist, there are certain foods that you don't want your patients eating, but what foods could escalate or aggravate diabetes?
Well, let's look at some of the energy drinks that they come in with.
Oh, now come on now, doctor. I like those energy drinks,
We all
doctor.
do.
Talk to me. How are they bad for us?
Oh my goodness, let's not even talk about the caffeine, but they've got more sugar than a can of Coke. And when you do that, I had a gentleman come in, 28 years old, he has 23 cavities, but he drinks a Red Bull or 2 every day. So, or another energy drink, not just Red Bull. I don't want to pick just on Red Bull, but there's 5 or 6 of them.
Absolutely, and that's just way too many because you're pretty much getting taurine, guarana, and caffeine mixed in with a little sugar and a little bit of water.
Yeah, lots of sugar.
Yeah. Well, when it comes to being diagnosed, and A few years ago, many of my viewers know that I was diagnosed with cancer in 2003. I had some chest irritation. We found that I had a seminoma tumor attached to my aorta. And what was interesting about it wasn't necessarily a specialist that caught this. A general practitioner looked at my x-ray and said, Gerard, you know, your chest x-ray looks a little cloudy. And so it's so important to press upon everyone. But you know what, I'm going to take a chance here, especially men who don't like to go to the doctor. Why is that, and how can we get men to check in with a physician, doctor?
You marry a smart woman.
Oh, yes, that's exactly what happened in my case. My wife made me go to the doctor, yeah.
It's the woman, and the woman, you know, calls up our office and makes the appointments for the children and the husband. You know, guys are guys. We're not going to want to go to the doctor, so if we hook up with a really good woman, we'll stay healthy a long time.
Yeah. You know, let's talk about dentistry again here. This is a question I've had on my mind for years. Human beings, we brush our teeth every day. We floss, we use mouthwash, we use tongue scrapers. Other animals don't have to do all this, and they don't have problems with tooth decay, do they? Why do human beings, why are we subject to having to have all of this oral attention when it comes to hygiene?
Well, we have a different group of bacteria, and out of the animal kingdom, we have one of the dirtiest mouths in the animal kingdom. So we have a specific bacteria that a lot of other animals don't have. Plus, we have a diet that's, you know, when you get to sugars and the carbohydrates, the bacteria in the mouth uses that carbohydrates and creates an acid. A lot of the other animals have a much better diet. They don't have fast food restaurants on every corner.
Yeah, you're absolutely right. Diabetes, stroke, cancer, being diagnosed or caught by a dentist. Now, I know that you're a cosmetic dentist. However, it's obvious that you care about your patient's cavities. I want to get back to these bleeding gums again now, because is there something that a person can use in terms of a soft brush, medium, more stern brush? What can you do besides diet to help that as well?
Well, again, from the inside and from the outside, we have some nutraceuticals. You can go to pharmaden.net. It's a nutraceutical, double-blind tested to help reduce bleeding, gums, and plaque. That's from the inside. And then from the outside, there's a closest mouthwash you could buy that at Walgreens now. It was developed by a periodontist that kills those anaerobe bacteria much better. And then there's some soft picks, some little toothpicks that you use in between the teeth that are really good. You could find those in the store. They're by the Sunstar or Butler company.
Yeah.
But we'll go back to this Americans Against Diabetes, because we got a real problem, and we really need Chicago to help.
Yeah. One last question before break. I don't know if we'll get your answer before the break here, but when it comes to a person losing limbs, doctor, I mean, people lose feet, people can lose, you know, parts of an arm because of diabetes. I mean, why does a person have to lose a limb? Talk to me. Okay,
because remember I told you that the high glucose in the blood damages the blood vessels. So those little blood vessels in the eyes and in the kidneys and in your feet, you know, that's furthest away from your heart. Those blood vessels just can't get that blood and that nourishment into all the limbs. So the limbs basically rot.
Yeah.
So you have to cut them off.
Yeah. We're with Dr. Ron Schefdore on Garrard McClendon Live. Hold tight, doctor. CLTV celebrates Juneteenth with a special edition of Garrard McClendon Live. $15,000 children diagnosed with diabetes. Man, CLTV celebrates Juneteenth with a special edition of Garrard McClendon Live. Freedom to choose a healthy lifestyle. Have you had a checkup lately? You know, it's so sad. Many Americans do not simply go to the doctor. I'm with Dr. Ron Schefdore today as we explore diabetes and we explore oral hygiene. Doctor, 3 tests that I saw you discuss on your website and on many of the television appearances that you've had. Cholesterol, blood pressure being checked, and C-reactive. Help me through these 3. Why are they important?
When a person has bleeding gums, there's 3 things that can get elevated in blood chemistry. And one is cholesterol, one is glucose or blood sugar, And then the other one is an inflammatory marker called C-reactive protein. Now, Dr. Rickard out of Harvard has some really good research indicating that C-reactive protein levels are a better indicator of a future heart attack or stroke. So what I train dentists to do is to take these levels at the beginning of the gum disease, go ahead and treat the gum disease, and then if they were high at the beginning, retest them. Most of the time they have come down dramatically. Now, if they haven't come down, then we know there's probably an additional medical condition, so we refer them over to their physician, and sure enough, 5 of my patients have had early cancer. You know, 2 of my patients didn't believe me they had strokes last year. I wish they would have gone. So this is a new paradigm where we're trying to train oral physicians, if you will. You know, let's pay attention to people's health, let's screen them and get them over to the physician where they belong to get some treatment.
You know, doctor, a very aggressive and controversial question that I'm about to toss your way. What is your concept or your opinion of Americans being incentivized for certain exercise and eating behaviors? For instance, wouldn't it be nice to get an incentive to be a non-smoker or have an incentive to be someone who could curtail their sugar intake? What do you think about that? Because escalating healthcare costs for everyone end up in the fold because people have bad eating habits.
Well, I've said this for years. You know, in order to get health insurance, there should be, if I'm healthy, I exercise 5 days a week, eat good, keep my blood pressure down, I should pay very low premiums on my health insurance.
Yeah.
The people that aren't, when they're required to go in for a physical, let's say every 6 months or every year, if they're not following those parameters, then they're going to pay a lot more.
Yeah.
And that's the incentive. You know, keep my premiums low because I'm doing something. It's kind of like a good driver. I'm a good driver, I should pay low rates. If I'm a bad driver, I pay more.
Yeah.
Unfortunately, it's not set up like that.
It's not. It really isn't. There's really no basis for, there's no incentive for eating healthy. People like to eat, and that's just kind of an American mindset. Anytime you can order a pizza at 4:30 in the morning, only in America.
Yeah.
Talk to me about this. Preterm labor and diabetes. I was looking at something on your website. Preterm labor, periodontal significance to pregnancy. What does this have to do with anything?
Yeah, preterm births and low birth weights are definitely associated with women that have periodontal disease, osteoporosis, pneumonia. I treated one lady, the physicians couldn't figure out why she kept getting stomach ulcers. Well, that particular bacteria, the pylorus bacteria, sits in the periodontal disease. I said, send them over. Sure enough, she had gum disease. We cleared up the gum disease, and she hasn't had a problem since. So think about it. All that bacteria can go through your system.
Yeah, and I'm seeing now throughout this show that all of this is connected. I mean, a pregnancy is connected to oral hygiene, is connected to diabetes. This is unbelievable. We're seeing how connected everything is here. Hold tight, doctor. Hit me on Twitter at GerardMC or send me a Facebook message at Garrard McClendon, CLTV.com/GML. That's how you get to the blog. Choose freedom, choose life with healthy choices. Talk to Dr. Ron Schefdore on his website. Welcome back to GML. We've got Dr. Ron Schefdore with us from Your Celebrity Smile. He is a cosmetic dentist with a purpose. Dr. Schefdore, let's get right into closing the show with the Americans Against Diabetes. Why? Why is this so important?
Because it's about children. Now, Chicago could really shine here. This is the first grassroots movement anywhere in the country that I'd like to duplicate in 50 cities. Healthy Life Labs has put up $1 million in testing, free testing. We need another $1 million for corporations or sports celebrities, people to buy the kits to test the children. We need another $1 million raised, and we can test 100,000 children this summer. Chicago will shine. You know, we tested this program at 6 retail outlets, and 27% of the children had diabetes.
Oh my! Whoa! Close to 1/3 of the children.
This is a huge problem, bigger than what I'm telling you. This is a huge problem. We have got to get this under control. President Obama, if you're listening, this grassroots movement of programs like this will save billions of dollars in our healthcare system 10, 20 years down the road. We'll spend millions. to save billions.
Yeah.
Think about this. A third of the country is getting ready to retire. They're baby boomers. A third of the country is going to have chronic disease, according to our survey. There's only going to be a third of the country healthy working to support the other 2/3. That ain't going to work.
Yeah, that's like utter demise. You know, how can someone contribute to this cause?
Well, they need to go to the website and see how many children you'd like to help. And that's as simple as it is. So AmericansAgainstDiabetes.com, AmericansAgainstDiabetes.com. Please go there. If you know a sports figure, if you know anybody in Chicago, corporate that wants to sponsor with us, United Way is behind us.
Yeah.
You know, and we got $1 million behind us.
Yeah.
You know, free lab testing. Now we just need someone to buy the kits, and we're home. We've got this down.
SIU graduate extraordinaire.
Best school in the state.
Dr. Ron Schefdore, thanks for being on Garrard McClendon Live, my friend.
Thank you for being so gracious and having me on.
All right, take care. You know, checkups are so important. Sometimes we neglect our bodies by ignoring the warning signs. I'm a 6-year seminoma cancer survivor who also suffered a paralyzed vocal cord with a speedy diagnosis. Chemotherapy and prayer, the freedom to choose a life in good health allows me to do this show for you. Thanks for tuning in to a special edition of Garrard McClendon Live. Keep your head up and always be encouraged on Happy Juneteenth.
The McClendon Report. Ask or Ask, Donda's Rules, Suit Shoes. All available at McClendonReport.com.